Hello, good day. My name is Dr. Yusuf Mathai of Oregon Health Direct Primary Care. One of the questions we get a lot from patients is, well, can I get my labs done? Can I get my MRIs or imaging done if you're not dealing with insurance? The answer is absolutely. We're able to send labs and imaging orders to any lab that you choose or any lab that is contracted with your insurance. But often, these labs and images tend to cost you a lot more than they may cost with a cash price. In this day and age, there's a lot of patients out there who have high deductible insurance plans. It's not uncommon to hear of somebody having an insurance plan that has a deductible of close to $5,000 per person and maybe $12,000 to $15,000 per family. And often if you're a young, healthy person or you have a relatively healthy family, you'll hardly ever hit those costs. Those insurance plans actually do make sense for catastrophic care, but for regular primary care stuff, it's really hard to justify the costs for a lot of things that we as physicians may do. And that's where cash pricing comes in. It's often not uncommon to have cash prices for imaging and labs and things like that being a fraction of the cost of what you might actually pay for. We recently had a patient who had to get an MRI done. He'd been complaining of shoulder pain that had been present for a long time, and he finally wanted to get in to see an orthopedic surgeon to get this taken care of. With his insurance, because he had a high deductible plan, the imaging was going to cost him about $1,800 out of his pocket. We were able to get the MRI ordered for him for about $290. We were able to order the MRI the same day without requesting any prior authorization from the insurance company. He was able to get in to do the MRI about 2 days later, and we were able to get him in front of the orthopedic surgeon within about a week. And so these are some of the things that tend to happen when you get insurance out of the relationship with patients, and we're able to move things on a lot faster. The same thing actually happens with labs. It's not uncommon to hear patients say, well, hey doc, I went and got this lab that you ordered. It's fantastic, you got all this fantastic information, but guess what? I have to pay $1,800 for this lab test. And often as a provider, you start to think, well, can this lab test really be that expensive? A lot of the cash price labs that we do use end up getting us prices that are a fraction of that cost. I remember I had a patient who had an advanced cholesterol panel that was done. It cost him actually about $1,200 to get this one cholesterol panel. With my cash lab, the price of that same test was about $20. Which, when I tell patients this, it totally blows their mind. How is it possible that these labs cost that much? The thing with insurance is once you get insurance involved in certain parts of healthcare, they end up becoming so many layers between you, the patient, and me, the provider, and the money just kind of gets lost in there. And so again, going back to that direct care relationship, we're really able to cut out a lot of those overheads. We're able to cut out a lot of those steps and really deliver you the care that you deserve.